Things that matter more for your pelvic health than internal pelvic floor work or Kegels. Hi, my name is Dr. Kaylee. I'm a pelvic floor physical therapist, owner and founder of the Hope Doctors Pelvic Floor Physical Therapy. And I wanted to talk about this because there's this misconception that Kegels or hands-on internal pelvic floor work is the only thing that's going to help any type of pelvic floor symptom. And I'm here to say that that's absolutely false. Some of the things that I have found to be absolutely more impactful is just simple education. What is normal for urination, bowel bladder function, sexual intimacy, like those kinds of things? What is normal? What's not normal? What are things to consider? What are things to look for? Things like graded exposure. If you're having pain or if you have trauma, how can we actually get yourself comfortable with understanding how to have that conversation, how to look and feel, how to have a self-assessment or allow yourself to assess your pelvic floor, getting comfortable going to a gynecologist or going to a pelvic therapist. Like graded exposure can be super impactful. Bowel function can be really impactful for your pelvic floor. If you're not going to the bathroom once a day and eliminating waste, that could be a problem. That could be one of the contributing factors for a lot of symptoms. If you have a high infection risk or a lot of issues with like bacterial vaginosis, that's something that's going on in the gut and the microbiome often, and so needs to be addressed systemically. And the same goes for hormones. If you're having a lot of hormone struggles, or if you're having a lot of symptoms like, hair loss or anxiety or irritability or dry skin, frustration, all these other things that can come up, we want to make sure your hormones are supported and make sure that that is in good function, along with making sure that your pelvic floor is functioning, walking every day, getting sunshine. Stress management is a big one. If we are super stressed, and our nervous system is chaotic and haywire, we're gonna have a lot harder time healing from any pelvic floor dysfunction. What else? Let's see, core function. So how does your core work? How does your diaphragm work and your breath? What's going on with your jaw? What about your feet and your mobility in your feet? What about the clothing that you're wearing? The clothes you wear can impact pelvic health. It's the same with shoes. What about your environment? Are you exposed to a lot of mold? Are you exposed to a lot of environmental toxins? Is that impacting how your body's functioning and how your pelvic floor is functioning? Glutes. How are your glutes working? Are your butt muscles turning on when they're supposed to? What is your posture like? Again, stress levels is a big one that always comes up, but nervous system function, mobility, structural assessment. Have you had a hip replacement? Have you had surgery? Surgical history is also impactful. And I say this because, again, all of these things can contribute to pelvic floor dysfunction, and the treatment approach is not always going to be or need to be internal pelvic floor work or Kegels, because for the majority of that, that's part of a treatment itself. High stress, we're working on stress management, which can be breath work, sunlight, walking every day, working on a priority list, working on those kinds of things, right? Nervous system regulation can be breath work, humming, learning how to do that. Bowel function, we learn how to push appropriately if we need to, how to splint if we need to, how to remove the stool if it feels like it's getting stuck. Fiber intake, nutrition is huge, by the way. Getting enough protein, getting enough collagen, making sure that your bowels are functioning in that way, but you're also getting enough good nutrients. Are you eating fast food all day? Are you hydrating with water? Or are you only drinking coffee? Those are things, again, that are super important for us to talk about. And when you see a pelvic therapist, if they're not asking anything outside of your pelvic floor, they're going to miss it. And so it's really important to understand that all of these things need to be discussed. They need to be educated on. You need to feel empowered about asking and understanding so you get the full picture of pelvic health care. But again, so much more than just Kegels and internal pelvic floor work. It is such a combined system, whole body, but it also involves, again, mental, spiritual, physical, all of the things. Emotional is another one that comes up, like just knowing, how do you feel about your symptom? How do you feel about what's going on? How do you feel about me as a pelvic floor therapist? All of this is going to combine in your treatment approach. So wanted to just do that reminder today so that you understand that it is so much more than just one thing. And that's why so many of my videos are around like connecting the dots or understanding it's a whole body approach. But let me know any questions you have below. If you've seen a pelvic therapist, I would love to know if you got a good eclectic approach. Did they ask these questions? Did they tell you about any of this and how it's connected? If not, let me know. I would love to know. So I hope you have a great day and see you soon.